It's World Suicide Prevention Day and we need to talk about COVID. Or more precisely, we need to talk and think beyond COVID. At the University of Birmingham, we have a portfolio of research into relationships between social media and mental health. And this involves an ongoing exploration of online harms and also sometimes benefits around content such as that related to eating disorders, and most recently self-harm, which was funded by the Wellcome Trust. At the moment, we are undertaking a project funded by Samaritans, which is specifically looking at self-harm and suicide content online through COVID, analysing the kind of conversations that have happened since the advent of lockdown in the UK on social media around self-harm and suicide. And the many suicide-related discussions happening on social media offer really crucial insights into the kind of struggles that have been brought to the fore by COVID, and which on this World Suicide Prevention Day and moving forwards, we really need to pay attention to. They speak of suicidality as profoundly social, as a social suffering, showing the struggle of living through recent events precipitated by the pandemic. There are conversations about isolation, family troubles, job losses and poverty, and people talking about how these are either driving them to suicidal ideation or taking them back to a place in which they felt that before, but had subsequently moved away from. As such, though, whilst there is a clear link emerging from social media between the pandemic and suicidality, we need to treat this with caution. It's crucial that we do not tie causality so neatly to COVID or lockdown that we fail to look beyond these at the societal contexts that have shaped their impact. Just as the unequal effects of the virus across communities have shone a light on existing social determinants of physical health, social media users' narratives poignantly elucidate the existing social contexts onto which COVID has mapped its mental health impact. The pandemic has both laid bare and exacerbated the structural violence, the pervasive inequalities, and the unmet mental health needs that were already with us in British society. It is therefore to these that suicide prevention needs to turn its attention, both through and beyond the pandemic. They show us that easy solutions don't lie in the easing of lockdown or in a quick return to a previous normal, because for many people that normal was already far too precarious. We need a whole systems approach to understanding and tackling the intersections of social precarity and suicide. A suicide prevention agenda needs to pay attention not only to the distress and inequality that COVID has undeniably precipitated, but also to those that it has simply exposed, which were already with us and which we now need to tackle.